Paddy-Whack is a 8-year-old male neutered rabbit that presented to the Exotic Bird Hospital in October because the owner was concerned because he wasn't eating a lot of hay. His appetite had changed. She was also noticing that his droppings were very soft, kind of tarry. They were sticking to his bottom. He was getting some redness around his bottom area, and he just wasn't acting the way that he used to. So she brought him in, we did a physical exam, and there were some things that were noticed right away. One, his front incisors were malaligned. His upper incisors were worn almost to the gum line, and the bottom incisors were overgrown. There was also his hair was kind of an unkempt appearance. It didn't look like he was grooming himself. When I felt his abdomen, his bladder was extremely large and hard. It felt like a piece of dough was in his bladder, and he was uncomfortable when I palpated it. He also had a good bit of urine scald around his penile area and his hind legs, where he was kind of just sitting in his urine and his feces. So we discussed these issues with the owner, and she agreed to do some diagnostic testing. We took some blood and evaluated his white blood cell count. We also checked his liver and kidney enzymes, which were actually both normal. We did some radiographs, and not only did we do radiographs of his body, but we also did some skull films as well to check his teeth. So as these were being developed and we were getting lab results, we did an oral exam under anesthesia. And he had some pretty significant dental disease. He had some teeth that were actually growing laterally into his gums and creating some ulcers. There was some teeth that were worn excessively. There was also one of his upper molars that was very loose, so that tooth was removed. The points that were growing into his cheek were cut and filed smooth, and we recovered him from anesthesia. He did very well during all of this. All of his vitals were normal. After the anesthesia, we put him on the floor, and he actually immediately started eating greens. He started picking at the hay, but he was still a little reluctant to chew the hay. But the owner saw immediate improvement. Now, after all this was done, he was awake from anesthesia. I went and looked at the radiographs and could see that the bladder was full of sludge, which was what I was feeling. We had actually expressed some of that sludge while he was under anesthesia, and it almost came out like a clay-like tube. There was so much calcium deposits in that bladder that it was just creating an excess of this clay-like material, and it was preventing him from urinating normally and creating a lot of discomfort. That clay has calcium crystals in it, and those calcium crystals literally burn the skin when it comes in contact with skin and creates a lot of irritation. Not only did he have the sludge in his bladder, he had some evidence of some arthritis in his hocks, which is his ankle joint. He had some spondylosis in his spine, which is just where the body creates a bridge between the vertebrae to try to stabilize the spine if there's like some slip disc or some other arthritis going on. He did have significant dental disease. The right lower mandible, the teeth were starting to be resorbed, and there was some resorption of the mandible. And what that means is that one, the dental disease cannot be cured, it can only be managed, but also that he's at an increased risk for for jaw fractures, for abscesses, and other problems that can come along with dental disease. Now, a week after I saw this rabbit, I talked to the owner. We had sent him home on antibiotics and some anti-inflammatories. The owner has noticed tremendous improvement. He's still not eating a lot of hay, but he's eating a lot more of his pellets. He is moving around better. His droppings have returned to normal, and overall his whole demeanor has improved. She reports that there's still some urine scald, but it's getting better each day. He's still not urinating in his box normally, but that's to be expected as long as all that sludge is present. Now, in the future, he is probably going to need regular dental procedures as his teeth are going to continue to grow abnormally. He may need some more extractions, and we may need to go in and catheterize him and try to flush some of this sludge out. But we want to manage the infection that's present and get him a little bit more comfortable before we get more aggressive with the treatment.